No, just Sheila Grant, I think, had asked a question. Andy's sceptical, so it's really helpful to hear some questioning voices, I think. So Sheila, I don't know if you want to come in.
Good morning. Can you all hear me? I've come in really after almost 15 years away from mental health. I'm conscious of time, so I'll try to be succinct in what I'm saying. I've been away for about 15 years. I've come back into mental health formally after working within the heart of Chapel Town with small communities, small groups of people on a one-to-one basis. And I think I'm sort of trying my best not to become emotional about it, but I am, because it means so much. That even though the language that I've heard this morning has become a lot more sophisticated, a lot more insightful, I still don't hear how you're going to reach me in the heart of Chapeltown. I'm still not hearing how the clients that are knocking on our door on Chapeltown Road are going to be helped. I still don't hear how Black workers that will be supported into leadership positions and moving up the scale, which is absolutely admirable, are going to be supported to work with their own biases around race so that they then don't transfer that onto the people they're working with. I still don't feel confident after so many years of being away and deciding now was another chance for me to see if I can get back involved and see if I can help, because what I'm seeing in Chapeltown is absolutely heartbreaking. So I just wanted you all as a group to hear, I absolutely admire all the work that's been doing, and I know how difficult it is. But I don't feel as if, as an African Caribbean woman, the mother of Afro-Caribbean young adults, the auntie to African young men who are being diagnosed mentally unwell, I'm not confident that we're going to get the help we need. I'm sorry if I sound emotional, but I apologize for that.
I just wondered if I could come in here, partly because you're absolutely right. I'm not going to try and diminish anything you've said, because many of the people that we're making this launch do today will have similar views to you. But one of the things that I take comfort in is that this review has been really challenging. And, you know, Rome isn't going to be built in a day. We're not going to be able to boil the ocean in one go. But one of the reasons, as I said in my opening speech, why I'm incredibly proud to chair this review is because we are starting to ask that question. There is nothing that can impact on us, I don't think, in our lifetime as COVID-19 has. When we saw the magnitude of death and suffering as both individuals in our families, but also in our communities, whatever community you belong to, we know that we've got to do something about this. So I think the very fact that this review has recognised that, and yes, it's been a long history. I've been part of that long history myself as community, asking those questions. But what we can do, the proof of the pudding is in the eating, isn't it? So we have made a commitment, and I think the voluntary and community sector have said, look, mate, we're going to hold you to account to deliver what you've said. And I guess that's where I'd want to say it. We've asked the tough questions. We're seeking those answers. We haven't got them all, but it's a start of a journey.
May I add to that? As an Asian woman myself, Sheila, you are voicing feelings that I've felt, that I've heard from my colleagues, and you know, the cynicism and the wariness to be hopeful, it comes from a place of not wanting to be let down again, and I hear that and I feel that. What I will say is you can't correct decades or centuries of inequality in a few months, and we're not aspiring to do that. What we are aspiring to do with this report is to acknowledge that something is wrong, to acknowledge that change needs to happen, but also a commitment on a very public platform that we're going to do something about it. And this is the first step in that. And it's going to take time. And we need help from people like you to get it right, because I don't have all the answers. Donna doesn't have all the answers. What we can do, and what I can assure you, is that there is a real appetite to share the power, which I've never seen before. There's a real appetite to share the resources, which I've never seen before. And there's a real appetite to give platforms to people that have not had it before. So all I can say to you from my own personal experiences, this feels different. I feel hopeful, and I've committed to this. I've put my heart and soul to it, as have many members on this review. And we need people like you to keep holding up a mirror to remind us of why we're doing it. But we won't get it right in 2 or 3 weeks or even a year. It's going to take time.
I think Robin wants to come in as well.
Yeah, I just what Sheila said is really powerful. I think that, I mean, I'm in my 31st year in public services, and we've all been in many reviews, haven't we? And many pieces of work, and been through, whether it's riots, disturbances, all of us, regardless of who we are, what our backgrounds are, our position in organisations. This review has been different. This review has been different because the kind of thing that Sheila's just described has been in the room. It's been in the room in the review. It's been in the room in the meetings, and others have expressed their personal experience, but others who actually professionally work on these issues have shared their experience, and the lived experience of someone seeking urgent care that we heard in the last meeting from a colleague in an organisation, the lived experience of a colleague who works in the sector but also had family directly affected, and that's had a real impact personally on me, and I think all of us. And I think, I'm not saying that's enough, of course it isn't, but I do think there's a rich picture that this review's got. It's now our responsibility, my responsibility, to make this mean something.
So just, Sheila, that was brilliant. And I think everybody, if you look in the chat function, there's loads of support for you of what you've just said. And it's great that, so thank you for doing that. And I think we should introduce something called the Sheila test. In all that we're doing. So what does this pass the Sheila test in terms of, is it seen and felt in Chapeltown? And it seems to me there are some practical recommendations that should help pass the Sheila test. So in the mental health recommendations, there's one about third sector organisations and support and applying different approaches to engaging with people on their mental illness, which are culturally competent. And all of that sort of finessed language, as you say, is really just about building confidence in communities and making sure people can access care. So I think let's introduce a Sheila test would be my plea out of that.
I'm mindful that there's been incredible involvement in terms of developing this, but we need to retain that involvement in the scrutiny of this as we move forward, so that actually we're consistently being called to account in terms of whether or not we're actually making the progress that we've promised. And I just wanted to get some assurance on how that might happen going forward.
So I suppose there's a couple of things I take from that. I mean, this has been incredibly powerful, hearing the different voices, and I think we do need to think about how we retain that as part of what we do. It's very easy to get squeezed out of kind of formal meetings and get back into a habit of simply discussing papers and recommendations, and finding different ways that we keep hearing that different range of voices in different ways is really important. I think that probably also overlaps with the question, doesn't it, about ownership of this. I mean, the partnership board is not separate to the organisations. The partnership is all of us together. So in one sense, we've committed to this by, by the work in commissioning this and by receiving the review and no doubt committing to the action plan. But I think also many of us will want to think a bit more about taking this back and getting some making sure there's quite specific ownership of this in our organisations as well, because I think there's there's a lot of learning for individual organisations in here, and it's important that we think about different ways that it's embedded, both within management but also within kind of those of us in governance roles as well. I don't know if that covers some of it. I think
it does. Tim, to some extent, and I can see, I'm conscious, Karen, that we're due to finish in about 3 minutes.
Yes.
And Fatima, you've got your hand up. Do you want to say something before we finish?
Yes, it was just to add to Councillor Swift's point about accountability and next steps. So obviously Sarah's alluded to the process by which we're going to develop the action plan, but the accountability will be in a range of forums. So to answer Helen's question, there will be a specific role for our third sector panel that will continue to work. There will be a role for our BAME network across the region in regards to providing constructive challenge, but also holding to account, as well as the partnership organisation. So there is something about that. This is a collective plan owned by everyone, and very much in the ethos and values of how we work as a partnership, which is that mutual accountability, peer challenge, but in a supportive way, because we want to get it right, and we're all about, you know, doing it for the right reasons.
Donna, is there anything you want to say before I round up?
I think it's really important that actually we recognise that there is a lot to do. We've come together, we've started a journey, and I recognise that there is a long history in West Yorkshire and Harrogate. But what I can say is that the panel that have convinced me, you know, I don't lend my name to any old review. And I appreciated chairing this because I got an absolute commitment that the individuals, the leaders, wanted to do something different. And I have to confess that was the very first question that I asked: are you really committed to this? Because, you know, I've done a lot of whitewashes and been part of a lot of whitewashes. That's not politically correct, I know, but in the past. But absolutely, the guarantee for me to join this review was that everybody wanted to deliver on this. And I think we've been very explicit in the review about the things that we want to tackle, and they're not easy things, and they will take time. So I just wanted to leave you with that, because, you know, I don't join any old review. I absolutely joined this because I believed that the leaders of West Yorkshire and Harrogate and others wanted to do something different.
Thanks, Donna. Udi, you want to go? I'll let Udi Archibald come in very, very briefly before I say a few final thoughts. Go on, Udi.
Thank you, everybody, for this work. One of the things that I am hearing, and I think is something that is reassuring, is it appears you're taking the state of emergency approach to this. What that means is we stop everything because it's been horrible and we're going to get it right. But I think for me, the test is always to make sure that we have some quick wins and that people will have that reassurance to see something in the next few weeks, next few months, and so on, because we are talking about a situation people have been waiting for years and years, generations. So what I would really, really like is that we start seeing things shortly that will reassure us and keep that faith and give us hope that more is coming. So it's a plea to the partners, it's a plea to those that will be delivering and implementing things. If we want to keep the faith and get people in these communities to trust us, we need to start seeing actions as soon as.
Perfect.
Yeah, it's Robin, Rob. I was just going to say I think that's really excellent. Thank you, Udi. I'm a real big fan of just seeing quick wins because it just shows intent. So I think we'll take that away, and we'll deliver on that.
So I was asked, I think, just to make some closing remarks, and I think I've been looking forward to this for some time, and I think it's been a really great hour and a half. It reflects, I think, a huge amount of work. So I must thank everybody who's been involved in this, everyone who's been involved to the panels, everyone in the community who came to speak to us, every third sector organisation who's been involved, the core team who have worked tirelessly on this, and Professor Dame Donna for chairing. I think I've been involved in health and care at all levels in the system, you know, right at the heart of government and right at the front line, and this is one of the finest pieces of work I've been involved in. You know, the quality of the thinking, the quality of the evidence, the quality of the engagement is outstanding. I think what we're left with is a promise really. I think what Alison's told us is you've raised our expectations now, and we're going to hold you to account because you've given us hope. So please don't make that false hope. And I think that's where we're left, really. We've got a plan here that we can execute because we can choose to as a group of leaders, and we can make a significant difference, and we can start making that difference very quickly so that people get hope that we can deal with generational systemic issues over time. And I'm really pleased. I'm very proud of the partnership for this work, and I want to be even more proud in the next 3 weeks, 3 months, 3 years that we've made the visible change that we want to see, and that we all passed the Sheila test. So thanks everybody for the work that you've done. Thanks for being involved. All of the resources are available on the website, and let's not make this the only time we talk about this review. So thanks everybody.